So obviously I think it's really important to delineate Waldenström's from other hematological malignancies. So I work in a NHS laboratory. It's really helpful to know whether it's actually Waldenström's or CLL or SMZL, if there's any kind of ambiguity there. So it's really important for the consultants for us to give them a result. There's a lot of other things coming through that are definitely going to be more important. In a routine diagnostic laboratory, it's quite difficult to do CD19 sorting. So obviously that would be an ideal step, but we're trying to optimize the genomics testing for unsorted samples so that it's a lot easier in the diagnostic setting. And obviously digital droplet PCR seems to be the next step, and that sounds very exciting.